Hello, come on in, please take a seat, rest up. You are 35 weeks today. Can you believe how fast this pregnancy has gone? I bet you're really starting to feel it. So, if you wouldn't mind confirming your first and last name. Awesome. And then it looks like you are 35 weeks pregnant today. You're ready for baby to come out? That is what a lot of patients say that are in your position, so I don't doubt that at all. All right, it looks like since we've last saw you, no new changes at all, which is good. Okay. You're not due for anything yet today, but Leanna, the PA, will be talking to you about getting a group beta strep swab done on your next appointment. So she'll kind of go into that a little bit more in detail as far as why we do it in the office. But have you had any changes to your insurance or pharmacy since we last saw you? You want to change the pharmacy? Okay, which one would you prefer? And do you know what city that's in? Okay. Let me see if I could find it. There we go. All right, so that is good there. Let's see. Anything new going on with you? Any concerns that you've been having at all? Okay, looks good. Any contractions? Occasional Braxton Hicks, you believe? No new onset headaches, changes in vision, nothing like that, right? All right, as far as your medications, anything that changed there? Still taking prenatals every day? You're all good to go there. Awesome. All right, and any bleeding that you've been having, loss of fluid? Okay. Is your family getting excited? I don't doubt that at all. All right, well, how about we get a chart started for you? So let me grab this. So we're 35 weeks, routine revisit. We are, of course, as always, going to start with your vital signs. If you wouldn't mind reminding me your weight and your height. Excellent. Alrighty, well, let me get to going here. Let me grab some hand sanitizer. And then let me grab a temperature check. Temperature screen here, beautiful. Alright, and the blood pressure cuff is there. I have been doing well, thank you for asking. Your family's doing okay? Everyone's healthy? Good, good, good. That is what we want to hear. All right, so let me just place this around me here. Okay. And we are just going to slide this around your arm. Does that feel snug? Good. Okay. pressure is normal. Let me take this off of you here. All right, slide your arm out. There you go. Alrighty. Next up, we have our temperature check. And then we will set up the station here for Leanna the PA to do your prenatal appointment. How is baby doing? Good. You're probably so excited to meet that little one. No, I completely understand. All right. Let me take this off here. Let us do that temperature check. All right, I'm just falling all over the place here. Okay, and this is gonna go right underneath the tongue. There you go. Just gonna wait a little bit. All right, very good. Temperature is within normal limits. Okay, let me put that away there. Alrighty, so let me write down your vitals here. Blood pressure, and then urinalysis. Awesome. And then we're just gonna get you set up. Let me go into the system here and sign you in so she knows that you are here. Okay, awesome. You should be good to go there. So how about we set up this tray then for her? Of course, for you, you have a little drape just to cover up your tummy if you need some extra coverage there, depending on what you're wearing. So what we're gonna do is we are just gonna take this mat here. We're just gonna place it on the tray. We've got the heart rate Doppler here. Let's see, we've got some hand sanitizer. Maybe we get some gloves. Okay, got some gloves. And then we got a couple different measuring tools today. Perfect. Oh my gosh, I almost forgot I gotta get a pee sample from you. So we've got both of our measuring tools. So we're all good to go there. Now lastly, before I step out, you have to leave that urine sample. We have to make sure you're not spilling any protein or glucose, of course. All right, your patient identifier is on there. So I am just gonna leave that for you here. I'll grab you a paper towel. You are just going to set it right here, and then we'll be sure to check it to make sure your urine is in the clear. I know, you've been doing this how many times? You probably were gonna remind me if I didn't know. Problem with the first morning visits. All right, anyways, do you have absolutely any questions before I walk out of here and Leanna the PA comes back in? You think you're okay? Awesome. All right, well, I am gonna let her know you are ready, and then she will be in to check your urine, to go over everything that I've collected here, ask you the questions, and then give you some counseling on what to expect for the future appointments. Not a problem at all. It was very nice to see you. I will give you some privacy now. Like I said, there's a drape right there on the table, and Leanna the PA will be in. See you later. Hello, hello. Good morning. Good, good. Can you believe that you were already 35 weeks pregnant? Pretty surreal, isn't it? For sure. All right. Well, let me kind of go through my standard questions first, and we'll go to the physical exam. As far as labor, contractions, she was telling me that you were having some Braxton Hicks, but no regular. Okay. Are you having absolutely any vaginal bleeding, gush of fluid, anything from down below that's been concerning? Okay. And then let's talk about fetal movement a little bit. Has baby been moving okay? Has there been a significant decrease at all? Baby's been moving good. Awesome. Still taking your prenatals every day? Great. All right, it looks like from Lee, the medical assistant's notes, your blood pressure was good. And then it looks like your urine sample was good there too, so I'll get that closed up in a second here. Weight gain has been looking great. All right, it looks like you are all up to date on everything, not missing anything there. Are you having absolutely any questions or concerns at all today? Okay. So let's see here. It looks like in 1 week, when you are going to be coming back, you will be 36 weeks. And at the 36-week appointment, most commonly done between 36 and 37 weeks, is what we call a group beta strep swab, or a GBS swab. Now, GBS is a really common bacteria found in our vaginal and intestinal areas. There are some patients that carry it in detectable higher amounts, and some patients that don't. And whether or not you're positive or negative, it is not an indication of bad outcome or anything like that. It's just more of an FYI for us to know if you have this particular bacteria. So what we do is there is a swab that we use. We insert it in the vagina for about 10 seconds. Then we pull it out. We swab around the perineum, which is the area between the vagina and rectum. And then we swab a little bit around the opening of the rectum as well. And then even just like a tiny bit in, but the swab is not getting fully inserted by any means. Now, with that being said, this will help us detect for GBS. There are options. If you're not comfortable with me doing it, we could always teach you how to do it yourself. I just find that some patients, given this point in the pregnancy, it's a little bit harder for them to feel like they, accurately swab down there. So totally up to you. I just wanted to confirm that for next week, though, you'd be okay with me doing it? Okay. Now, the biggest reason we do this is, let's say you don't get the swab at all and you are positive for group beta strep or GBS, then when baby comes out vaginally, they will be exposed to this bacteria, which could cause serious infection in the baby when they're born. And in some cases can be life-threatening. So that's the primary reason that we do it. Now, let's say when we do swab you, it comes back positive. It just means that we know that when you're in labor, they will give you antibiotics to prevent baby from being exposed to that bacteria. Does that make sense? Awesome. All right. So I just wanted to explain that part to you. But how about we get started on the physical exam? All right. So I am just going to put some hand sanitizer on first, and then we'll just put some gloves as well. Do you have any questions or concerns at all? Okay, I am just going to expose your belly here a little bit. I'm going to place some paper towels to kind of protect you from getting lubricant. Let me close up your urine sample here. All right, so let's start off with some heart tones. Alrighty, baby. Let's see how you're doing today. Heart tones are looking beautiful today, averaging in the 130s. Alright, just going to remove that. We'll wipe it down a little bit here. This is just to kind of pat dry. Alright, let's get to measuring now. We will start with this measure here. Just going to feel a little pressure from me. Start with the front. Evaluating where the top of your uterus is or your fundus. Measuring really well with this one. I'm going to press on you a little bit more here. Okay. We will use the second tool. Excellent. Fundal height is completely appropriate, so everything looks really good with baby today. Alrighty. Do you have absolutely any other questions or concerns today? I feel like everything's pretty straightforward. Are you comfortable with everything regarding the education of the GBS swab? Do you need me to give you more education on it to look into it, or you're pretty good there? Okay, awesome. Alrighty, well, let me grab your clipboard here. So the girls at checkout know how to get you scheduled. And then I will see you in 1 week to do that group beta strep swab. So of course, I always tell people, just expect to get undressed on your next appointment, okay? Yes, just from waist below. Awesome. All right. Well, I'll give you some privacy here, and the girls up front will see you for checkout. Not a problem at all. I'll see you next week, Mama.